Assalamu alaikum. The article for this week is Tooth Fracture and Associated Risk Factors in Permanent Molars Treated with Vital Pulp Therapy and Restored with a Direct Resin Composite. It's a retrospective cohort study published in 2022 by European Endodontic Journal. Basically, the vital pulp therapy is currently considered the viable options for the management of vital permanent teeth with deep caries. And according to the European Society of Endodontology, types of vital pulp therapy procedures based on the concept of non-selective caries tissue removal to hard dentin, including indirect pulp capping, direct pulp capping, partial pulpotomy, and coronal pulpotomy. So the aim of this study was to evaluate the survival from fractures and risk factors of vital pulp therapy treated permanent molars restored with a direct resin composite in young patients. In the methodology, a total of 234 treated molars from 189 patients were collected from dental records of patients aged between 6 and 18 years old at the Pediatric Dentistry Clinic between 2012 and 2019 with an overall average follow-up time ranging from 6 to 83 months. Inclusion criteria: teeth treated with non-selective caries tissue removal to hard dentin, followed by one of the vital pulp therapy procedure according to the ESE position statement. Teeth restored with a direct resin composite. They had at least one opposing tooth with occlusal contact. They had participated in at least one recall. They had all required data documented in the dental records. And the exclusion criteria including teeth reinforced with the metal bands. The assessment of the fracture were: first, fracture restorability, which was classified into restorable fracture and non-restorable fracture. Second, the fracture itself were classified into three types, including a natural tooth structure fracture, a restoration fracture, and a combination of the natural tooth and the restoration fracture. Lastly, the fracture location on the remaining tooth structure were also documented as being at the marginal ridge, at the cusp, or at the marginal ridge extending to the cusp. The survival time to failure was set at the time between the date of the treatment and the date of the fracture. Moreover, the potential risk factors, including sex, tooth location, stage of the root development, number of marginal ridge losses, type of vital pulp therapy procedure, and pulp dressing and paste material used were also investigated. In the results, regarding the survival probabilities from fracture of vital pulp therapy treated permanent molars, 21% of molars had fractures, with the majority of them, 92%, were restorable. Radiographically, only 4% of the fractured molars had periapical lesion and considered vital pulp therapy failures. The percentage of the fracture type are as follows: 54% natural tooth structure fracture, 27% restoration fracture, and 17% combination fracture. And the most common fracture location among the 37 molars with natural tooth fracture was at the marginal ridge with 59%, followed by the marginal ridge extending to the cusp with the 21%, and the cusp itself 18%. The cumulative survival probabilities of these teeth decreased over time, reaching 66% after 5 years. And regarding the potential risk factors associated with the fractures, two significant potential risk factors affecting the survival from the fracture were tooth location and the type of the vital pulp therapy. Other variables were considered not significant risk factors. Regarding the vital pulp therapy treated molars in mandible had 2 times higher risk of fracture than those in the maxilla. Furthermore, the teeth treated with a partial and coronal pulpotomy had 2 and 4 times higher risk of fracture when compared to those with the indirect pulp capping, respectively. However, there was no significant difference between the teeth treated with the indirect pulp capping and direct pulp capping. In conclusion, in vital pulp therapy treated permanent molars in young patients, more fracture were seen in the mandibular teeth and in teeth with the pulp-proof removal, partial and coronal pulpotomy. Clinicians should plan for the proper restoration on these teeth, and interim full coverage crowns such as stainless steel crowns may be considered when necessary. Thank you.